Welcome everyone. I'm Pam Schaff. I'm the director of the HEAL program, and I want to welcome everyone to today's event. This event continues our mission to align the work of patient artists with our core medical school curriculum and to foster enhanced understanding between patients and future health professionals. Today, we're really excited to welcome Kathy Nida, who Ted will introduce more fully. But I first want to introduce also Dr. Sigita Cahoon, who is the director, or what do you call it, system chair for the reproduction system, yeah, which the students are studying now in year 1. And she is also an assistant professor of clinical obstetrics and gynecology. So we're super glad she's here to be part of our conversation. So Ted, our artist in residence, will you take it away and introduce Kathy and our session?
I will. Kathy is a fantastic artist. I've known her through different venues for a long time. She's a painter, but what I've been most impressed by is that she does these amazing quilts. They're very complicated, they're very layered, there's lots going on. And what's interesting to me is that quilting is usually thought of in the crafts world, not so much the art world. And it's decorative and it's pretty. And, you know, our grandparents made quilts as part of community. Yet Kathy does these sort of explicitly sexual images, or not so much sexual, but explicit images about childbirth and medical things dealing with reproduction. So first of all, there's sort of jarring images, but the fact that she's taken this venue that's normally in the crafts venue and given it a narrative, which is sort of unusual. It just always impressed me. So I'm going to show some of Kathy's images, and we're going to go through them. Everybody, Dr. Cahoon, feel free to comment if any of the images strike you as something you have a good story about. But Kathy, let's start with talking about a little bit of, everybody has to talk about their medical issue and why they do this sort of work. So why don't you talk a little bit about that while I call up your images.
Well, I'm female, so I have a uterus, and apparently I'm a little obsessed with it. I have given birth to 2 children, so that does figure into some of what I do. I had fibroids until, well, from when I was 25 years old, I was first diagnosed, and I kind of did think of them as aliens in the uterus for a really long time. And I also teach 7th grade science, and sex ed is part of the curriculum that I teach. So I've been doing that for 18 years. So every year at the end of the year, I spend 6 weeks explaining to 12-year-olds how the reproductive system works and about childbirth and sexually transmitted diseases. And so it all started to show up in my work. I did start with body systems when I started teaching, but the only one I really teach now is reproductive. And so I always think of as being a woman, you spend like the first 10 to 12 years of your life not worried about your uterus, and then you spend like the rest of it dealing with it for the variety of things. Is it going to have babies? Are you going to have a period? Is it going to be an awful period and then menopause? And it's just like this annoying little creature inside you that's doing all these things that sometimes it feels like you have no control over. So that's why it shows up in my work a lot. So
all right. So before we even, well, we'll get to the whole sex ed question later. Let's start with your artwork now.
sure.
All right, here we go. All right, tell us what's going on here. I see a baby.
There is a baby. It's falling out. This piece, absolutely nothing. I know that the prompt, sometimes we get themes for shows or for groups, and this is one of the groups I was in, and they were talking about war. And I always think of, as being a woman, sometimes we are at war with our uterus, but also with society about all these things. So you see all this, you know, should we wear high heels? Do we have to wear a bra? Which is really annoying in the last year, let me tell you. So she's got her uterine flag, there's birth control, all these things are like, we're at war with it. You've got your DNA in there where it's like, I don't choose to be, you know, a genetic female, but I still have to deal with all the parts. And so she's standing on this pile of male bodies. Because sometimes, honestly, I'm, you know, trying to explain to, say, a male doctor what's going on. And they're like, well, that shouldn't be a problem. And I'm like, I'm sorry. So it's just, that's where that came from. We're kind of regularly dealing with this thing that we're at war with, but we have to live with. Ah, yes. So the whole story of the crone and the mother and the maiden is where this came from. And so the crone is supposed to be this woman with wisdom and all this knowledge. And so she's got her staff and her owl. And then we have the mother on the left side who's holding the child and nursing the child, and the maiden. And we, we have all of these parts inside of us, and that's where this came from, and kind of being rooted into the earth. I do a lot of pieces where the bodies are sort of rooted down into the earth. So it was kind of just like, as I was approaching menopause and everybody's like, oh, it's going to be so much easier. Everything's going to be wonderful. And there's pros and cons. As a woman over 50, there's a lot of invisibility that happens. But on the other hand, the uterus stops being such a pain in the butt most of the time. So that's a plus. So it's just a sort of a comment on that whole triad there. This piece. Birthing the Gender War. So I was looking at a show where they were looking at the differences between genders, and I only dealt with the two basic biological genders. And so I feel like as a society, we've kind of birthed this war between the genders that we are not necessarily dealing with particularly well. And I got a lot of trouble for like showing full on these figures emerging from this, vulva and vagina. And I'm like, well, but we do give birth, guys. This is, to me, it's a very natural process. And I teach it that way. And it sometimes gets me in a little bit of trouble, but this image to me was just this really strong, like where I have a girl and a boy. And when you raise a girl and a boy, how do you raise them so that they don't think, oh, this is things girls do, this is things boys do. And dealing with my students in the same way, trying to give them a wider perspective.
So you just talked about sort of getting in trouble for these images, and not just educationally, like you've had trouble in the art world with these images. Like you were telling us that Patreon won't even show your images because they're adult content. And
right. So Patreon.
No, I was just gonna say, so it's interesting, like violence is fine, but here you depict birth and you get censored.
Well, and I'm doing quilts. And so choosing to use quilts as my medium, and I've loved fabric for years. So I did used to be a printmaker and a photographer, but I love fabric. But choosing to do quilts means like the quilt shows are like, why is this here? But then the art shows are like, that's a craft. And so I'm in this hard space between, I don't think that what I do is a craft. I mean, there's a craft to making it, just like there's a craft to painting or sculpture. But it's hard to get shown in quilt shows because of it. And it's hard to get shown in art shows because of the medium. So quilt shows, they like prettier quilts most of the time. A lot of them, they want to see landscapes and pieced stuff. And that's obviously not what I'm doing. So it does get me in trouble.
There we go.
So this is connected at the hips, and I was just kind of, as we've gone through the years, like I said, I've been teaching sex ed for 17, 18 years, and more talk of gender issues and what we have in common. And so even, I have students who are questioning where they're at. And so people that are female or identify as female, we kind of have this common, what does being a female mean? And I'm like, well, okay, we don't all have a uterus, and some of us have a uterus that doesn't work, and this thing where you're supposed to be a woman and you're supposed to have a baby. So I was just kind of trying to look at this. How do we start relationships? How do we have conversations? One of these is a mom, maybe another one isn't a mom. One doesn't want to be a mom. One doesn't have the parts to be a mom. And so that's where this kind of came from. Well, so when you asked me to do this show, I was like, do I have quilts that are actually just about childbirth? I mean, childbirth shows up in a lot of them. And so I had this idea of just drawing one that was childbirth. Of course, most of us don't sit out in a field to give birth, though it might be easier than some situations in hospitals. So just trying to have her be connected to the earth, and yet the birth process. A lot of people don't like thinking about, wait a minute, I'm actually going to push that out. There's going to be blood. There might be other materials. I like to think of it more like with medical technology, but this is a natural process. So connecting it all to nature. So that's kind of where I was coming out from this, because to me, childbirth, as me personally, it was a very positive experience. Pregnancy was not, but the childbirth itself was, I think, one of the most amazing things that I've gone through in my life. But I know for some people it's not. And so I was kind of connecting back to how I felt about it.
And okay, so the skeleton hands coming up from what looks like hell, what's going on
I
there?
think of those as like ancestors, like, the people before us. So, we bury our dead and they're down below. And I have to say, so I drew this during COVID. And so I was like, no, I'm going to, because I had done 2 COVID quilts before that. And I was like, I need to get it out of my head. So I'm going to draw this. Well, the COVID molecule is in there, or virion, because I can't get it out of my head. And plus we still have, like, I've got fire, I've got the oil drums down here, I've got a volcano erupting. So like, there's still all this really bad stuff going on in the world, but I'm like, but childbirth's still happening. We still have babies being born. People, it's that I can't get away from that stuff of everything's cool, but there's really bad stuff happening. Yes. I was asked to do a piece for a show called, what was it actually called? Something about what matters most to you. And so I was looking at, as women, there are, and of course this one I believe was made right at the beginning of the last presidency. And so I was getting all these vibes of women are less than. We're less than because we can't do all the things that men can because, oh, our uterus makes us hysterical. And I mean, I've been hearing this stuff all my life, and my students will still parrot it back to me. So they're still hearing it at home. And so I was just trying to make this woman, she's got all her ancestors above her, a lot of other women, what are they worried about? We've got the, sewing. I think there's aliens up there. We've got wedding rings, birth control, DNA, science, all the things, money, love, cooking. Why do women always have to be in charge of the cooking? They don't. And I threw the ERA in there and votes for women. So I was like going way back in history and all the stuff I'd sort of been raised with. My daughter is, she used to say, well, I'm not a feminist. We don't need feminists anymore. And I'm like, wait, what? So I'm kind of sort of a raving feminist. So I was asked to do what's important to me. And I'm like, women's issues, women's rights, everything that women or those who identify as women need in order to be successful and as equal as we can be in the world. So it's a huge quilt. And that's where this comes from. Big story. So this is one of my older pieces. And this is the first one that I really got in trouble for. When I had been teaching for a little while, every year I would get laid off because there were too many teachers and there was a shortage of funding. And so they would lay us off every year, and then they would rehire us back on. And I was a single mom at the time. My kids were little, and I didn't have enough money to get through the summer most of the time. So they don't pay us during the summer. So you have to save each paycheck. And I was literally one paycheck away from being absolutely broke on a regular basis. And that's one of the negative things you see happen to women in divorce, is that a lot of times the pay scales don't add up. And so I was in this place where we were asked to do a piece about homelessness. And I was focusing on these women who have these children, and you're literally one paycheck away from living in a cardboard box out on the street. And it's a very scary place to be. And that's where I was kind of going with this one. And people were upset because there's a vulva in it. So, but also because they don't want to think about women being homeless and families being homeless, I think was also part of it. So. Some like it hot. This is a menopause quilt. Come on. So I did a series of bathtub quilts. So I had looked at Frida Kahlo's bathtub paintings, and then George Bush did a bathtub painting. It's actually pretty good. And so I'm like, because bathtubs it's this feeling of calm, and, you're sort of relaxing and it's warm. And so I would put all the things around the bathtub that were sort of part of my existence. I dropped all the clothes. I've got a letter down there, cheesecake, because, menopause, it just messes with you across the board. And this is the dog, of course. And so her uterus is floating in the water, because like there's times when it was the worst part of going into menopause, and, you feel like you're on fire constantly, and you're like, just take it out, which my mom had a hysterectomy pretty early on due to fibroids. See, there's that again. And I was trying to avoid that because my opinion is the uterus, even once it's done making babies, still has a purpose and still provides something to us. And for my mom, they were just like, oh, well, we'll just take it out. You know, if it's doing something wrong, just take it out. And they did the same with my grandmother, and there was nothing wrong with her uterus. There's nothing in there. They just took it out. And I was like, no, I'm going to hold on to it. But there's times when you're just like, no, just get it out. Just, if it's going to keep doing this to me, get it out. And of course, it's really not. I mean, it's just, you know, it's the hormones more than the actual uterus. But anyway, it's an entire menopause quilt. So way too hot. So this is another one of those, all the things in my head getting out onto a quilt. This is actually a pretty huge quilt. It's, I don't know, it's just huge. And I have all this stuff in my head. You watch the news. At this point, they were taking children away from immigrant families. I was like, all these things about being a woman again. And so we've got pollution, we've got recycling, we've got graffiti, we've got the American government taking away children, we've got ICE, we've got, you know, men sending pictures of, there's dick pictures in there somewhere on one of those, you know, being able to have babies, not being able to have babies, abortions, which is another, you know, most women at some point in their life at least have to think about that concept and consider it. And so I call it Womanscape because it's like a landscape of all the things that could be running through my head or any woman's head at any given time. So I was just trying to incorporate all of it in one go. Politics, government, women's issues, you know, the whole thing. So Work in Progress is actually, again, it was a show where we were asked to come up with a concept, and I was asked to do gender equity. And so again, going back to that, things hanging in the tree, that what do we apply to female versus male? You know, you think about, well, a woman has to be the one to give birth, and she then has to be the one that breastfeeds. If you're going to breastfeed, though, you know, there's bottles as well. And so hanging in the tree are all the things we're responsible for or that are associated with us. We've got embroidery, football, bottles, hammers. You know, he's got the briefcase with the money in it. And then I've got arrows pointing to the parts that are supposed to define us. You know, like men have penises, women have uteri, and that's not totally true. You know, and maybe that shouldn't be what defines us. And so I was just kind of trying to make a comment on how do we make this more equal? How do we get people to think about it differently and think about the tasks and the have tos a little bit differently so that there's a little bit more equity in the world.
So just for people that are watching this, like hour-wise, I know this is the the annoying question people always ask painters and craftspeople, like that big quilt, how many hours that Womanscape one?
The bigger ones are going to be 150 to 180 hours of work. And just to be clear, I have a full-time job. I teach middle school, and so and I do this at night and on the weekends. I don't sleep a lot, but like I am an artist first and foremost, and I do love my day job, but sometimes I wish it took less time. So the smaller quilts take less than that, but they are very time consuming. I can't bang out a quilt in a couple days. It's going to be weeks. So I get about 6 big ones done a year.
All right, well, now we can bring Dr. Cahoon in on this. And I will admit, you know, so I missed a lot of school when I was a kid, and the only even sex ed I remember was the girls all going to watch a film about their period, and the boys went and played dodgeball, and that was our sex education, that the girls had something going on that we didn't.
Wow.
So,
Wow.
so well, I'm old. So, but before we get to that, I saw you taking notes, Doctor, during this. So if you want to talk about anything that came up in the quilts, and I will talk about the keep versus remove uterus, because that seems like something where when most gynecologists were men, they would say remove it. But now that gynecologists are more women, I would think it would be a move toward, as Kathy said, it's got a purpose, keep it.
Probably not. actually.
Really?
I think we still, were taught by our mentors, most of whom were from that time, a time where it was like, oh, if you're done having babies, then this is just going to cause you problems, give you fibroids, cause you cancer, take it out. So I would say that that's the strong gynecology, like, starting point. And then people may have a difference of opinion depending on their own, like, personal experiences, life beliefs. I was taking notes because I found these quilts were amazing. And I actually didn't realize they were quilts. I thought they were collage when I looked at them online. So maybe I'll just take a step back and thank Pam for inviting me, because I reached out to her being like, hey, I want to be more involved in the arts over at Keck, because that's my own personal interest. I had one point when I was applying to undergrad, wanted to apply to art school to be a painter, and then totally changed course and went to medical school instead, but have found art always to be this source of inspiration. And I can't believe we came together for this particular showing, because your work is really, like, there's so much here. It's so amazing. I wrote down a ton in terms of, like, things that came up in picking out your images. I think especially breastfeeding, like, kind of came up in a lot of your images. Is not something that becomes a more, for me personally, it was a much more emotional experience than I thought it was going to be. It just sort of is like, oh, well, you can do it, or you can do formula or whatever. And, like, when I went through the process, I was like, there's so much more here than I ever knew. So for myself, I guess, and how you were saying, like, should we take the uterus out? Do we recommend that as doctors? I feel like my own growth personally as a physician has been kind of like maturing and understanding, moving on from all the memorization of med school of, like, I need to know all the hormone pathways, I need to know all the nerves and blood vessels, and then understanding more how emotional this is. And so right now the medical students are in their reproduction system. They just started it on Monday. And one of the things that I say in my introduction is that you can be kind of surprised by the emotions that come up, because now that they're learning reproduction in medical school, they're kind of, sometimes it brings back your experience of going through sex ed when you were in middle school or high school, or it brings up all of those issues that you had questions about that now you're getting a new understanding to. So I brought that up to them as students, and then myself as an OBGYN, as I thought about whether or not I was going to have children, then did have a child, then went through breastfeeding, and now went through the postpartum period. I have a cohort of co-OBGYNs who went through the postpartum period, and we were like, nobody taught us about this. This is crazy. This is not like 6 weeks and then you're done. This is like so like this period of time is so life-changing. Why don't they teach about this? So we've become kind of active in talking about the emotional and life impacts of reproduction, fertility, complications with that in the various stages. So, I mean, your quilts are these amazing manifestations of all that.
Cool.
Or anything else from the quilts you want to, any high points before we move on?
I mean, you bring up a lot of imagery on, like, fertility, on whether your body, I mean, they resonated a lot with me in terms of that feeling of, even if you hadn't particularly thought very much about wanting to have children, as a person who may bear children, you come to a point in your life where you're thinking about, is this going to happen or not? And it's like, it definitely is this feeling of perhaps like your body's betraying you if it's something that you want to do that you can't do, or that it's this expectation that's kind of put on you as a burden if it's something that's not in your plan, but there's family or societal expectations that you go through this process. And I did write down how interesting, you have a lot of these childbirth images, and that's another thing, even from like a midwifery and birth doula standpoint, there's a lot of lack of information for people about what's going to happen to their bodies as they get pregnant and then go through childbirth, which is really this like weird puritanical holdover, because people should know what's going to happen to their bodies. And so there's a lot of activism from midwifery and from doulas of filming births, filming home births, filming natural births that end up getting taken down off the internet as inappropriate imagery. And you're like, this is kind of the completion of a life cycle. Like, why isn't this something that women can know is going to happen to their bodies? So.
And I did actually go through a natural childbirth course before I had children. So that was that was my background going into it. I ended up having to be in a hospital due to medical issues, and I straight up didn't really enjoy the hospital process.
Yeah.
But I was at least educated enough. I had educated myself enough with videos and everything, and the birth program I went through, that I came in with a birth plan and said, this is what I want, and you don't get to argue with me. And I had a partner who was, when I was incapable of saying no, he was standing there saying, no, it's in her birth plan, you need to knock it off. And so that is why when I go in with my students and I'm educating them, I'm like, you need to know so that you can ask for what you want and what you need. And that doesn't mean you know everything, because you can't, because that's the number one thing about childbirth and all of that, is that baby's going to do what it wants at some point and you don't get to control it, which is that's your life lessons.
Yeah.
Trust me, mine are adults. They're still going to do what they want, right? But that's what I'm like, the more education, the more information you have going into it, the more positive an experience it's going to be. So.
Well, one of the things that
let's talk-
oh, sorry.
No, you first.
I just wanted to respond about the hospital birth experience. One of the things that I teach now that has kind of, again, become much more real for me is most of the people taking care of your birth have never experienced birth. So, it traditionally was male physicians who may have seen many births, but don't know what it feels like.
Right.
And then if you're talking about medical students and residents, of course, there are some who have had children, but the majority haven't. And so I went through my whole OBGYN residency and had children after, and yet I was in charge of what was happening on labor and delivery and not understanding the process until I went through it myself. And so that's something that I teach now in terms of we are still working on how to teach to have true empathy, and why should a patient have to really advocate for themselves to have an experience that they want, But part of that is that a lot of the people providing their care haven't been through the experience. And so they're kind of parroting what they've been taught without having that empathy of like, this is a totally life-changing experience that someone's going through, and we need to listen to what they're saying they need.
Right. That's a positive.
So do you think that it makes a difference? Should someone going through this, should they look for a female doctor? I don't know if there's still a lot of guys still going into this in this day and age. Both of you, or anybody who's talking today who's here, who's had a child.
Yeah, I mean, I think that men that go into OBGYN now are men that are very emotionally intelligent in terms of taking care of female patients. I think there's a culture change happening there. But I mean, I think that's where pregnancy and childbirth got so medicalized, and now we're kind of moving back to more of a midwifery model. And the midwifery model was always very women-centric and birth experience-centric. And so if that's important to somebody, because there's many different factors that come into play, then they might want to look for that.
Like my mom wanted a male gynecologist because she's older, and so she associates, medical knowledge with men. And I was like, yeah, no. And the hardest part for me is like, even though you went to your OB-GYN the whole time, when it actually came to giving birth, they weren't necessarily the one that was there. And honestly, mine was there, but she came in the last 3 minutes, which I get it, I understand. And I was, at that point, I was managing, and the nurses knew to not do the things. And she just came in for the last bit, which is fine. But, in the stuff going on, because I had 2 very rough pregnancies where I was hospitalized during the pregnancies because I wouldn't stop throwing up. And so I had a lot of male doctors dealing with me then, and they're like, well, you just need to do this. And I'm like, do you know what that is? Do you know what that, and they're like, and they go off. And of course, this is a while, it's, my kids are 25 and 24. So it's not like, this is yesterday, but that kind of completely turned me off that. And so it's good to hear that there's kind of a more of a, if you're going to be an OB-GYN, you need to think about the people who are actually doing all these things and what they might be thinking. It's much positive.
Right. So I do want to talk a little bit about the sex ed thing. So maybe Kathy, you could talk to us a little bit about you. So you're dealing with 8th graders. What do they think they know, and what do they really know? And maybe Dr. Cahoon, you could explain to me how you keep seeing these stories on TV of women who like have babies and didn't even realize they were pregnant. So let's talk a little bit about how sex education might stop that from happening? So Kathy, you go first, and then we'll transition to the doctor.
So my students are 7th graders. They're 12 years old, and I've been teaching sex ed for this, well, not during Zoom, but this would be my 18th year. And it's not segregated by gender at all. I do segregate in the classroom because straight up 12-year-old boys are somewhat immature. So I put them on one side of the room and I put the girls on the other side just to give them that little bit of space. And then I have some boys that are kind of sort of not so boy. And so I put them in the middle. So you have to really think that through. And then we go through all of it. And at some point the boys are like, why do we need to know this? And I'm like, do you ever want to have a relationship with a girl? And maybe you don't, and that's okay, because we teach all that too. But we spend about 6 weeks going all the way from relationships and that kind of stuff through, consent, gender. We teach gender now. We didn't used to teach that, which, is fine. And then pregnancy, childbirth, puberty, and sexually transmitted diseases. And then how to sort of protect your reproductive health, whether you're male or female. And the one thing that always stands out to me, two things. First of all, we do an anonymous question box. So the kids are given cards, and every day they can put their cards in the box, and the next day I answer all of them. And I do it all from a scientific, place. So they get all their questions answered, and there's a lot of giggling, and sometimes I have to say the word penis 14 times before they'll stop, but that's okay. I can handle that because I've been doing it for a long time, and I want them to have that information. But the one thing that I kind of laugh about it, but on the other hand, I'm like, oh, geez, when I teach puberty, you go through what happens to boys and what happens to girls. And with girls, you're talking about the periods. And like, I get a ton of questions about, so when does this stop? And wait, does this go? And how does, wait. And then the real question is, what do boys have that's like that? And I'm like, nothing. And the girls are like, what? That's not fair. And I'm like, okay, let's deal with this fair thing, because it's not fair. You're right. So take a breath and think about, the pro is it means at some point you might be able to create life, and that's kind of cool. Don't do it now. You need to wait till you're old enough and you have all that support. We talk a lot about that, but you're right. It's not fair. This is what your body does. So that's really hard for the girls, because you'll see them. They'll just be like, what? That's what? And the boys are like, we dodged a bullet, man. We totally did. So that's always interesting to me as a female teaching all these kids. So
for the med students that are going to be watching, who are here now, are going to be watching this later on tape, do you have, they're going to have students, they're going to have patients, they're going to have to start talking about sex depending on what field they go into. Do you have a good advice for them about how to start this conversation?
Just being really empathetic to the fact that, and I think most of you guys know this, like when people come in and they need to talk about this stuff, it's terrifying. Even as somebody that knows, the right vocabulary, I always tell my students, you can ask questions, and if they won't answer you, get a different doctor. And that's making sure there's time for those questions, and that as a doctor that you're paying attention to all those nonverbal cues, that there might be additional information they want to give you, or a question they might have. And it honestly, it takes experience, I think, because even when I teach it, I'll be sitting there going, and I know enough to know, wait, I know what your next question is going to be. And just getting that experience and making sure that you're trying to be it's a terrifying thing to go in and ask a total stranger about something to do with your body. And one of my kids, I remember him telling me this story. He was playing baseball and he got hit in the balls with a baseball, and he had to go to the doctor. And the doctor, of course, is sort of half paying attention. And he's like, so what's the problem? And of course, this kid, he's trying to use the right vocabulary, right? Because I'm going to be smart. I think he was 14. He was held back a few years. And he's like, I'm going to be using the smart vocabulary. He says, so he meant that there was a problem with his scrotum. He wanted to use that word and be, scientific, but he said rectum instead. And so that poor kid, and I'm like, and he's telling me this, and I'm like, oh no. And he's like, so what happened? He says, he made me pull my pants down and bend over. And I'm like, well, because you said rectum, sweetie. It's okay to use poop hole and things like that if you need to in order to make sure they're touching the right parts, And I'm like, so what did you do? He says, I told him to get out of there. And I'm like, well, good. So we have one kid that knows what to do. But so that just those situations, I mean, that's a funny one. And it ended well, but there's a lot of that I'm sure goes on in that kind of medical situation. So
And now to you, Dr. Cahoon, so assuming the patients, and again, for the med students, didn't have Kathy as a teacher, but they're coming to you as adults, how much misinformation do they still have when they show up with you sometimes, or people?
Yeah,
Pretty
I would say it really depends on
knowledgeable.
where you work. And so I work primarily at the county hospital. And so we have a spectrum of like geographic origins for our patients, but I would say most people have had almost no sexual education at all. And so we're often teaching adults who have pathology that potentially needs surgery, kind of what organs are inside your body and what your period means. And, if we remove your uterus, what does that mean? Will you be able to get pregnant? Will you still have a period? Will it make you go through menopause? Actually, what's the function of your ovaries versus your uterus? So that's primarily what we deal with over at the county side. And I would say we have this form. I actually wrote that down when I was thinking about this. We have a form. It's like a very county thing where we make patients sign that they understand that if we remove their uterus, they won't have a period anymore and they won't be able to become pregnant. And I'm sure every county form like this comes because something happened. And so now we have a form for it for the next time. So somebody had a hysterectomy at some point and didn't realize what the implications of that would be for their health. And so now we have this form that we make everyone sign. And it's like, procedurally kind of strange, but also should make us stop and really use the words when we take your uterus out, you won't get your period anymore. You won't be able to get pregnant in your body. Is that okay? Are you okay with this? So that's what we function with majority in my job. And then my colleagues who work over kind of on the Keck Verdugo side have a little bit of the opposite. They have patients who've been doing tons of research and come and they know exactly what they want. And, it's a different skill in terms of navigating what your patients want and need.
Okay. We can sort of open this up if anybody has questions, or Pam, if you would like to chime in at the moment. I just keep, I don't know, I just keep thinking of Kathy's job and how, the boys and the girls when I was in junior high, thinking they knew ways to keep from getting pregnant that were completely fanciful,
Mountain Dew. Mountain Dew is
Okay, let's hear that one.
Yeah, I apparently, if you put Mountain Dew in the vagina, it will stop you getting pregnant. I have heard so many. I had one student, a girl, come to me after class, and she was like, "So I can't get pregnant because my boyfriend isn't making sperm yet." And I'm like, "How do you know that? Do you have a really good microscope?" And she's like, "Wait, what?" I said, and I go through the whole thing, and she's like, "But he says he's not making it yet." I'm like, "He doesn't know." So there's a lot of that where sometimes I'm a little terrified. Like when my kids were that age, I would tell them all these horror stories and they're like, "You need to stop telling us this." So I'm like, I just need you to understand that this is how it works. So there's a lot of misinformation. And the other thing is, when I could tell exactly when the internet started to be, I know I'm so old that when I first started teaching, the internet it existed, but kids didn't have the same access to it that they do now. And it was really obvious to me when the boys started watching porn, because the questions changed. Why do women have hair down there? And I'm like, oh, holy moly, we're going to go off on this one. But that whole thing of the internet has totally changed, because they think they can Google everything and they'll get the answer. And I'm like, well, Google's not perfect. And straight up, Google has some really wrong stuff when it comes to reproduction. Absolutely. And so a lot of them are using that as their education. I mean, there's always been that my older brother says, and I'm like, okay, well, come back to me in 5 years and let me know if your older brother's girlfriend is pregnant. So it's always been an issue with that misinformation stuff.
I think Corinne said she had questions earlier. Do you want to ask any questions, Corinne? And then anybody else, obviously, feel free.
Yes, I have questions, but I was just thinking how ironic it is that you have this job educating people about their bodies, and then out in the older world, people are in the world itself, that people are so horrified
Yeah.
with vulvas and vaginas and the whole thing. It's just, it just shows how far we have to go.
Yeah.
I noticed in most of your images of people that you have hearts and lungs. And wondering why you think you picked those particular. Or-
I used to teach all the body systems, and some of my pieces also have like stomachs, pancreas, liver. I'm diabetic, so I have a couple pieces that are full on, you know, you got syringes and stuff everywhere and all the pills you have to take. And so it depends on, the hearts and lungs always end up being in there because, you know, that whole, like, you're dependent on those two systems in order to stay alive. I mean, yeah, I don't put brains in a lot of them, and I do. You do need your brain too. But it's interesting because when we used to teach all the systems, one of the questions we would have after we looked at all the systems is which one do you not need in order to survive? And the reproductive is the one you don't need in order to survive. And the kids were like, the boys especially, they're like, wait, but, and I'm like, I didn't say I was going to cut it off. You know, I'm just saying you don't need it to live, you know? And so, but we spent a lot of time thinking about it, that's for sure. So yeah, so I tend to put a lot of the different systems in there. It's just a matter of how much I have room for in the drawing. Because I have friends, they're like, are you putting more details in there? Because it takes me longer to do in the more details. And I'm like, maybe. So, and so the cardio and the respiratory just seem more important to me. So I guess I put reproductive up with those two, which is a little weird.
I also noticed a number of cats. And Ted also has cats in his, well, yeah, you have one, but the fact that they're in so many of your pieces, and Ted also paints cats. I'm wondering about the significance to you.
They're comfort to me. Cups of tea also show up. So the things that provide me with some sort of comfort, or they're like, you know, sort of representative of me. A lot of these come out of sort of a self story. Not all of them, but you know, in fact, I have friends who sometimes, you know, so I'll get an email saying, "Where's the cat? There's no cat in this one," and I'm like, "Okay, sometimes I do them without cats." So yeah, there's cats, there's dogs. Christmas lights used to always show up. I stopped doing those for a while. So there's just things that represent. They're sort of symbolic to me. So birds, ravens.
Mm-hmm.
So those kinds of things. You can spend a lot of time staring at one of those up close and seeing a lot of different details. And then someone will ask me to explain all of them. I'm like, honestly, when I draw these, I'm like sitting down in front of the television, staring at something I'm not paying attention to and just drawing, and whatever's in my brain just kind of blah, 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 out onto the paper. And so I can't, like that birth quilt, you know, I couldn't draw a birth quilt without putting, you know, leaking oil drums and skeletons and the COVID thing in there. I couldn't do it. I couldn't just focus on the one thing. So there's my brain for you.
So since we're nearing the end, Doctor, you get my standard question, which is, why did you choose the specialty, and what personality-wise, what makes you good at it, and what do you think the students that are thinking about it, what kind of person they should be?
That's a good one. So I sometimes teach about this a little bit because I think for medical students, they're very anxious about like, what kind of doctor am I going to be? So I usually start with that I had no interest in OBGYN when I started medical school because of my own experiences going to get a pap smear, and I thought it was pretty boring. And so I was like, why would anyone spend all this time doing that for the rest of their career? But actually, once I got to the field, I realized I didn't understand what the field was about, and that you could really improve people's quality of life with the types of skills that you learn in OBGYN. And so I was always drawn more to the childbirth part of OBGYN, the obstetrics part. And I still feel that little like privilege to be there for the moment a family gets to meet their new child, and I get to like see the baby first. And, you know, it's just this huge privilege, and I love it. But I would say that most OBGYNs are very interested in surgery. And so we didn't get to talk about the fibroids too much, but I would say that women who have, you know, hemorrhages with their periods that require blood transfusions, that was something I had never known about because we don't talk about periods, because periods are this shameful thing. You see commercials about tampons and pads that use, you know, strange blue fluid because we can't show red because that might upset someone. You know, and so to learn techniques that are curative, like doing a hysterectomy or doing myomectomies where we remove the fibroids but preserve the uterus, was, you know, very mind-boggling and gratifying. And I would say the last part is that it's a very emotional field. And I think that if you like being in an emotional field, you'll connect with your patients better. And so I think that makes me a good OBGYN. You know, I kind of like the drama, and I like to be there for my patients when they're going through some of the most dramatic times of their life.
So do you follow them? Because we've talked in the past about, you know, some doctors stay in touch with families, or is this sort of a once the baby's done, a lot of times you lose track of them, or do you become part of the family in a way sometimes?
I'm not that kind of OBGYN because I'm centered at the county, so I'm mostly teaching, but we do have patients who come regularly to get their care there. So that's the kind of OBGYN practice that I like, is where we continue to see people after they've delivered their baby and they're coming back for issues with their period or their pap smear. And so that's the nice part about OBGYN, is that we're surgeons, but we also have that primary care continuity of care aspect, which is definitely something that I like. But as a county and academic OBGYN, I don't have like a private practice, so I don't see my own patients forever.
Okay. Kathy has just posted her website if anybody wants to see this work and other work. And the HEAL website also has Kathy's statement and all the images that I showed today, if anybody wants to look at them for a longer period. So I want to thank you guys, and I'm going to hand this back to Dr. Schaff.
Thanks, Ted. Thank you, Kathy. Thank you, Sigita. That was a great conversation, and so revealing about so much more than just art or just you know, reproduction. It was really terrific. I had a question, Kathy. I know this is kind of a little late, and but I'm just so curious. Because we're not seeing the art live, and because my eyes are not particularly good, I'm wondering, is this, what are you working? What's your materials? Is this, are they fabric quilts, and do you do quilting as well? Is it applique and quilting, or what are you doing exactly?
It is mostly cotton fabric. I sometimes use other materials. I use all of the standard quilt processes. I don't piece my quilts, so I cut all the pieces out of different fabrics and then iron them down using a fusible web. So it's a machine applique. If I did it by hand, it would take me 10 million years instead of just the
Yeah, when you said those many hours, I thought, I don't know how you're doing that in so short a time.
I do quilt just like I mean, I learned how to make normal quilts when I was about 23, and somehow then I went from printmaking into doing what I did in printmaking with fabric. And honestly, that was because I needed something that was portable. Like printmaking is really hard to do when you have small children. And so I was a printmaker until I had kids. I did a little bit of quilting. And then once I had the kids, I needed something that was not toxic and that I could carry with me to soccer games and in the car and while waiting for piano lessons and stuff like that. I needed to be able to do stuff in my hands. And so that's how I transitioned into turning all these images into fabric. And then at some point I was like, wait, this is way better. And so that's why I kept working with fabric. So I have a pretty hefty fabric stash. I'm one of those weirdos who learned to sew when I was 7, and I sewed my own clothes in middle school because my mom made me. I know, so I was that geek. And so I kind of never walked away from it's tactile. You can touch it, and just the palette that comes with it. You know, I'm not really good at painting. I'm good at the color that comes to me with fabric. So it's just kind of what I'm built into for whatever reason. I don't know why. Mom was a weaver, so maybe the whole textile thing just kind of hipped me up the head or something.
Yeah, no, it's great. I love looking at it, and look forward to reviewing and seeing more, and hopefully one day seeing it in real life in our gallery.
I was going to say Womanscape. Was it Womanscape? No, it was one of my other ones, was in LA just a little while ago, and the show just closed, which is a little bad. But so my work does get out there. And so usually the current exhibits section on the website, right now it's out of date, but usually that, just because COVID, man, how many shows have been canceled for that? But I do get work up into the Los Angeles area for those of you guys that are up there on a regular basis. So
that's great. Well, thank you all for attending. Thank you, Ted and Sigita and Kathy. Ted, for your masterful facilitation. And we will look forward to our events, hopefully soon back on campus, either in the gallery or in the auditorium, but with our artists showing their work in the gallery. So thanks all for being with us in this weird era, and for making, Kathy, for making beautiful art for us to enjoy. Thanks so much.
For inviting me. I appreciate it.
For sure. Bye, everyone.